Welcome to Medibrook International Competitive Academy. I am Ajit. Today I am going to explain some CHO questions and its answer. So before my section, I would like to explain about the Medibrook International Competitive Academy. We are preparing the students for getting their government job. Especially, we are providing the training for the community health officer, NORCET, as well as those who want to go to the abroad countries. We are providing the courses like HARS, DHA, NCLEX RN, as well as OET and IELTS. So anyway, I'm going for the today's section. So first question we can discuss. What is the fifth stage of demographic cycle? You can see the option: high stationary, early expanding, late expanding, declining. So if you're reading this question, you can identify which is related to the demographic cycle. Demographic cycle, that is which is indicating related to the human population. So we can divide the human population cycle. That means we can divide the demographic cycle into 5 stages. So I will explain you about the demographic cycle. Then after that, we can come to the answer. See, in the demographic cycle, we can divide it into 5. So first one is a high stationary that we can consider into the stage first. In the stage first, in this period, there is a high birth and the death rate. In India, up to the 1921, the stage which that means the human population which is in the high stationary stage. In the second stage, that is early expanding stage. In the early expanding stage, there is high birth rate as well as the low death rate. In India, up to 1970, you can consider there is in the early expanding stage. When you are moving for the third stage, that is in the late expanding stage. In the late expanding stage, low birth and the death rate. If you are comparing these both things, the birth rate is just higher than the death rate. So in India, now we are having under the late expanding stage. The demographic, this is another question you can expect in India, according to demographic cycle, in which stage. So now the India, it's in the late expanding stage. In the stage 4, that is a low stationary stage, that you can identify there is a low birth as well as the low death rate. This you can see mainly in the developed countries. And the stage 5, that is a decline stage. In this stage, there is a low birth rate, but the death rate is high. For example, you can take as a Japanese population, otherwise a German. So in that place, you can identify there is a declining the population. So that you can consider there is in the 5th stage. So in the question, you can see again, the question, they are asking the question which is related to the 5th stage of demographic cycle. इसमें कौन सा साइकिल है 5th स्टेज में है? मैंने बोला है डेमोग्राफिक साइकिल मतलब क्या है? ये ह्यूमन पॉपुलेशन के बारे में जो एक स्टडी है, साइंटिफिक स्टडी ऑफ ह्यूमन पॉपुलेशन. अगर अपने इंडिया में देख रहे हैं, इंडिया में पहले दैट मीन्स इन द 1920 का उसी टाइम इंडिया में जो ह्यूमन पॉपुलेशन का ग्रोथ दैट वी कैन कंसीडर इनटू द हाई स्टेशनरी स्टेज. देन आफ्टर दैट अपने इंडिया में अप टू 1970 तक जो अर्ली एक्सपैंडिंग स्टेज में था. देन आफ्टर दैट अभी जो प्रेजेंटली इंडिया में जो चल रहा है लेट एक्सपैंडिंग स्टेज, इसको मैं ऑलरेडी बोला है. लेट एक्सपैंडिंग स्टेज में क्या होता है? लो बर्थ होता है, डेथ रेट ज्यादा, डेथ रेट भी लो बर्थ एंड लो डेथ रेट दोनों भी इक्वल हो सकते. इक्वल मींस थोड़ा से बर्थ रेट ज्यादा है, डेथ रेट कम है. बट अगर लो स्टेशनरी स्टेज में जाने से दोनों क्या है? लो होता है. सो अभी अपना बर्थ रेट भी कम है, डेथ रेट भी कम है, बट फिर कंपेयर करने से थोड़ा बर्थ रेट क्या है? ज्यादा है, उतना है डिफरेंस. देन अगर ये क्वेश्चन से इफ यू आर कंक्लूडिंग द आंसर, हम लोग को जो मिल जाएगा 5th स्टेजेस क्या है? डिक्लाइनिंग स्टेज. डिक्लाइनिंग स्टेजेस आल्सो आई हैव सेड अर्लियर. इसमें क्या होता है मैंने बोला है, उसमें बर्थ रेट क्या होता है? कम होता है. डेथ रेट क्या हो रहा है? ज्यादा हो रहा है. सो वो कारण से पॉपुलेशन में जो चेंजेस आएगा. सो अगर नॉर्मली डेथ नॉर्मली बर्थ दैट मीन्स इक्वली अगर हो रहे हैं, हम लोग बोल कर सकते लो स्टेशनरी में जा रहे हैं. बट अभी अपना इंडिया में ऐसा नहीं है. इंडिया में अभी जो चल रहे हैं दैट इज अ लेट एक्सपैंडिंग स्टेजेस. बट सम स्टेट में लो स्टेशनरी स्टेजेस में low stationary stages mein chal rahe. So anyway, our answer in the 5th stage is that is indicating the declining. Then next question, which vaccine help to prevent diarrheal disease? इसमें कौन सा vaccine diarrheal disease से prevent करता? So you can see the option. First one is a BCG. Second, it's a pneumococcal vaccine. Third, HPV vaccine. That means human papilloma vaccine. And last one is a rotavirus. Otherwise, you can consider as a rotavirus vaccine. See, in this BCG vaccine, you know that BCG, I have heard that which is using for the against the tuberculosis disease. Tuberculosis, you know, tuberculosis which is caused by the Mycobacterium tuberculosis. In 1921, Calmette and Guerin, that is find out about the BCG vaccine. This BCG vaccine we are giving in the intradermal route. That is, at the birth, we will give 0.05 ml on the left deltoid area. जो BCG वैक्सीन के बारे में ऑलरेडी तुम लोग ऑलरेडी पहले मैंने जो वीडियो बनाया है उसमें ऑलरेडी दिया है. इसमें इंट्राडर्मल रूट में देता है at birth time if it is 0 जो birth 0.05 ml on the left deltoid area. Then related to the pneumococcal vaccine. Pneumococcal vaccine, pneumococcal which is related to the pneumonia, as well as we can say this vaccine sometimes we can help from the meningitis also. So for preventing the streptococcal pneumonia, mainly we are using the pneumococcal vaccine. The pneumococcal vaccine, the route is there is an intramuscular as well as we can use in the subcutaneous. Then if you are moving for the another HPV, that is a human papillovirus, otherwise human papillo vaccine, which is we are taking from the intramuscular route. That is when there is a increasing the vaccine, that means human papillovirus. So to protect the female person from the particular infection, we can give the particular vaccine, that means the HPV vaccine. Then the rotavirus. Rotavirus means that virus which is mainly affect the under 5 children, especially the highest incidence which is occurring the 6 months to 2 weeks of the baby. जिसको 6 month का 2 years का बीच में है, वो लोग को जो diarrheal disease जो ज़्यादा develop हो रहा है, that is in the rotavirus which is causing the diarrheal disease. So in the diarrheal disease, to prevent that, we can give the rota vaccine. Since rota vaccine mainly we will give in the 6, 10 and the 12 weeks, sorry 14 weeks, 6 weeks, 10 weeks and 14 weeks. That means in the 3 doses. Mainly this rotavirus we are giving the route, that is in the oral route. So oral route में क्या देता है? Rotavirus. So now we can see our question again. Which vaccine help to prevent diarrheal disease? So we can first on BCG, already have said that is for the tuberculosis, pneumococcal, pneumonia, HPV, that is human papilloma, and the rotavirus. Rotavirus vaccine we are giving against, that means prevent from the diarrheal disease. Then next is the third question. Third question, it's a female sterilization myths. What do you mean by female sterilization? Say the sterilization you studied in the family planning. That is, this is in the community you have studied about family planning. In the family planning, you have studied the temporary method as well as the permanent method. Now the questions which is asking the permanent method, that is female sterilization. So you can see the options. First option, IUCD, oral pills, hormonal method, tubal ligation. So is in this, which is the right answer? So IUCD, intrauterine contraceptive device. The intrauterine contraceptive device, there is 3 generation. इसमें जो 3 generation होता है, first generation, second generation, third generation. So this is, you can consider one of the temporary method. Already I have said temporary method bhi hai, permanent method bhi hai. So in the temporary method, we are using the intrauterine contraceptive devices. There is a 3 generation, first generation, second generation, third generation. The first generation means that is non-medicated. And the second generation you can consider into the copper IUD. This is very commonly using the second generation copper IUD. In the copper IUD, either copper IUD 200 or the CU2 380. If you are taking the life duration, agar jo CUT 200, uska duration kitna 4 years. CUT 380 maximum we can use for the 10 years. So the iska jo expense, that means the copper T ke bare mein frequently question aa raha. Then in the third generation, normally you can consider there is a hormonal releasing, that is a progesterone and levosterone, which is releasing along with this intrauterine contraceptive device. So this is, I have said, this is a temporary method. ये मैं अभी जो बोला इंट्रायूट्राइन कॉन्ट्रासेप्टिव मेथड क्या है, एक टेम्पररी मेथड है. इसमें मैंने जो 3 जनरेशन बोला है, फर्स्ट जनरेशन में नॉन मेडिकेटेड है, उसका एक एग्जांपल है लिपेस लूप. सेकंड जनरेशन के लिए कॉपर आईयूडी यूज करता है. कॉपर आईयूडी में 200 का होता है, कॉपर आईयूडी 380 का भी होता है. ये कॉपर 200 मैक्सिमम ड्यूरेशन इट्स 4 years. Copper T, that is in the 380, we can maximum use for the up to 10 years. Then the third generation, we are using some hormones, the hormone which is controlling the pregnancy. Then next, same as oral pills. The oral pills, if you're taking the different classification, the oral pills, either the person can take the combined pills or post-coital pills or progesterone only pills, once in a month pills or male pills. So combined pills means you know that there is a mixture of the tablets. So for example, in this combined pills, you can consider near about the 28 tablet. Yeah, combined pills ka andar 28 tablets hota hai. 21 tablets which is related to the oral contraceptive pills. Then another 7 tablets which is related to the iron. So when the person should take this medicine, ye medicine kab wo medicine khana hai. So usually this medicine, it start in the 5th day of the menstruation cycle. In our government, which is they are providing the free cost medicine from the combined pills. जो combined pills है, अपना जो government free करके दे रहे, Malayan, Maladi, that is a combined pills. Then same as you can consider about the post-coital pills. Then post-coital pills that we can consider as a mini pills. Mini pills means that this medicine should take within the 72 hours. Then progesterone only pills. The progesterone only pills means the main advantage of this pill means there is no cardiological effect. इसमें जो कोई भी cardiological effect, adverse reaction नहीं होगा. Once in a month pills, that means monthly once. Then the male pills. So these all are things which is related to the oral pills. Initially, I have said the temporary method. First one is related to the copper intrauterine device. That means the particular device we are implanting. Second, orally the person is taking the medicine, that is oral pills, to preventing the unwanted pregnancy. Then next, at last option, that is a tubal ligation. Tubal ligation, you can see the picture of the uterus and the fallopian tube ovary. See in this picture, you can see the site of tubal ligation. And the two picture you can identify. One side you can see with the scissor, they are cutting the fallopian tube. So tubal ligation means this is one of the surgical procedure. They are just cutting the fallopian tube. जो ट्यूब को क्या करेगा, कट करेगा. So once if you cut, अगर इसको कट किया, that is a permanent method. This is not a temporary method. So remaining, already I have said what are things that everything is which is related to the temporary, but this is the permanent method. So again, you can read the question. From the question, you can find out the answer. So female sterilization means IUD, that means intrauterine contraceptive device, which is a temporary method. That is implanting the copper T. Oral pills means the person is taking the medicine orally. I have said different types of oral pill. Then hormonal method. Hormonal method means they are giving the hormones, either which like a progesterone. They are administering the medicine hormone, and after that they are regulating the unwanted pregnancy. That means controlling the pregnancy. Then the tubal ligation. That is last time I have said that tubal ligation. In that you can identify there is a cutting of the tubes. Tubes means fallopian tubes. So what is the right answer? Yes, the right answer is D. Then next question. Who discovered hepatitis B virus? Say hepatitis B virus, who is discovered? So first option you can see Louis Pasteur. Second, Robert Koch. Third, Ronald Ross. 4. Blumberg. So in this option, Louis Pasteur. Most of them heard about the Louis Pasteur. He's the father of the microbiology. He find out the rabies vaccine. So, as well as the germ theory is proposed by the Louis Pasteur. So you can filter. Louis Pasteur is not discovered the hepatitis B. Then another 3 option you have. Robert Koch. Who is this Robert Koch? Robert Koch. It's find out the tuberculosis. Otherwise, this tuberculosis we can consider Koch disease. This tuberculosis disease we can consider in the barometer of the social welfare. अपना जो society का welfare कैसा identify कर सकता है means based on the tuberculosis. For the detecting the tuberculosis, we are using the Mantoux test. तुम लोग सुना होगा Mantoux test के बारे में. The Mantoux test में there is a Mantoux test. We are using a PPD. The PPD we are injecting the medicine in the intradermal route. Then the angle of the that intradermal medication. Which needle we are using for this Mantoux test? What is the finding of this Mantoux test? ये तुम लोग बहुत बार सुना होगा. Which hypersensitivity which is coming under the Mantoux test? So ये Mantoux test का बाद में कितना mmHg से ज़्यादा हो रहा है? That is reactive. If it is taking the immunological patient, otherwise a HIV patient. Agar if it is more than 5, you can consider there is a patient is a TB positive. So Robert Koch, which is related to the tuberculosis disease. The third one is Ronald Ross. Ronald Ross, you know about malaria. Malaria, different types of malaria. Malaria cycle discovered by the Ronald Ross. You heard about different type of Plasmodium. Plasmodium vivax, Plasmodium filariae, Plasmodium malaria, Plasmodium ovalia. So this Plasmodium, which is coming under the malaria, these are the things is coming under the malaria cycle. So malaria, which is caused by the Anopheles mosquito, usually the incubation period is 10 to 14 days. Say this rebreeding, mainly the malaria breeding, which is occurring in the black water. So the Ronald Ross, which is related to the malaria cycle. Then another last option, it's the Blumberg. The particular person discovered the hepatitis B. Hepatitis B, which is caused by the DNA virus. If you're taking the different types of hepatitis, hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E, a subvirus, these are causing the DNA, but except hepatitis B. Then if you're taking the transmission, hepatitis A, which is transferred from the fecal oral route, hepatitis B, either which is parental, other is because of the blood transfusion, because of the sexual transmission, which is occurring mainly in the hepatitis B. If you're taking the intubation, 45 to 180 days, you can consider as an intubation period of the hepatitis B. So from this, you can find out the answer. I have said about the Louis Pasteur, Robert Koch, Ronald Ross, Blumberg. Robert Koch मैंने बोला है tuberculosis, Louis Pasteur मैंने बोला है father of microbiology. Then rabies vaccine के बारे में बोला है. Ronald Ross, it's related to the malaria cycle. So which is the right answer? That is a Blumberg. It is a right answer. The person it's discovered the hepatitis B virus. अगर इसमें और भी explanation करने से means ज़्यादा explanation करने के लिए है. पूरा explanation करने से तो time तो बहुत ज़्यादा लेगा. So because of that reason, I'm just including कैसा एक answer में तुम लोग find out करना है, पहुंचना है. That is the way I am explaining. Then another question, that means this is today last question. The vaccine administers nose drops. इसमें कौन सा medicine nose drops से डालता है? So you can see the option: rubella, poliomyelitis, influenza, measles. So first option, rubella. So rubella, which is caused by the RNA togovirus. Rubella is caused by the RNA togovirus. So which is mainly we are giving the route of the subcutaneous injection. You know about the MMR vaccine, mumps, measles, rubella. So this MMR you can consider into the subcutaneous. So you can see this option. First one is rubella, then last one is measles. So these both are we are giving in the subcutaneous route. Rubella, which is caused by the RNA togovirus, measles, which is causing the RNA paramyxovirus. But if you're taking the difference in the measles, which is mainly, you can identify symptoms like a Koplik spot. जो tongue, that means in the mouth का अंदर में एक Koplik spot identify कर सकता है. Then, if you're taking the poliomyelitis, in the poliomyelitis, you can identify polio virus 1, 2, 3, different types of poliovirus is there. For preventing that, we are giving the vaccine. There is a Salk and Sabin that I have said in the last class, IPV, OPV, oral polio vaccine का बारे में बोला है. Indra, that means IPV vaccine, the injected form of the polio vaccine. So polio vaccine नहीं है. Rubella subcutaneous route बोला है. Measles subcutaneous route बोला है. Which is another option. It's influenza. The influenza which is caused by the orthomyxovirus. This orthomyxovirus we can treat. अगर इसको treat कर, this is also this affecting the respiratory system. For this treating, we can use the nasal drops. So nose drops we are mainly using for the influenza. If you're studying about the influenza or be influenza, otherwise you heard about the H1N1, that is a swine flu. As well as same time bird flu, that is a H5N1. So ये influenza causing disease. So from this explanation, you can conclude the answer. The vaccine which administered as a nose drops, that is a influenza. So today I have said about this 5 questions. Then from this 5 questions, I definitely for your CHO purpose, more than 20 questions you can. I have explained related to the each and different answer. From that, maximum 20 से ज़्यादा question का answer इसका अंदर है. Then if you want to continue more, अगर तुम लोग को इससे ज़्यादा पढ़ना है, you can join with our course and we will take more portion which is related to the CHO exam, as well as we are preparing the students in the NORCET exam also. Okay, thank you.